Mr. Zaman, and here's what I bring to you all from the world of medicine. Study shows nocebo effect may influence the side effects of COVID-19 vaccine. People's negative expectations and general attitudes towards the COVID-19 vaccine are significantly correlated with the occurrence and intensity of its most common side effects such as fatigue, muscle pain, headache, and injection site pain. This is suggested by a study published in the Psychological Science Journal and led by scientists from the University of Bologna, who investigated how adverse effects reported after vaccination can be influenced by the nocebo effect, the opposite of placebo effect. New potential target for treating vascular disease identified. Vascular smooth muscle cell or VSMC activation plays a crucial role in the development of multiple vascular diseases. In a novel study in the American Journal of Pathology, researchers found that when fragile X-related protein 1 or FXR1 is absent, VSMC proliferate more slowly, become senescent, and scar tissue, that is neointima, development is reduced. Therefore, drugs targeting FXR1 may treat vascular proliferate diseases. To extend their understanding of the impact of the absence of FXR1, investigators performed RNA sequencing on FXR1 depleted human VSMCs. Their results suggest that FXR1 appears to stabilize a group of transcripts involved in control of the cell cycle, most of which are associated with proliferation and cell division. In addition, they noted an increase in beta-galactosidase and gamma-H2AX molecules indicative of cell senescence. Long-term beta blocker used to curb further heart attack risk questioned in recent study. The accepted clinical practice of using beta blockers over the long term to curb the risk of further heart attacks or death doesn't seem to be warranted in patients who don't have heart failure, suggests a large study published in the journal Heart. The researchers found no difference in these risks between patients taking beta blockers more than a year after their heart attack and those who weren't on these drugs. To strengthen the evidence base, the researchers drew on 43,618 adults who had had a heart attack between 2005 and 2016 that required hospital treatment and whose details had been entered into the National Swedish Register for Coronary Heart Disease. The researchers wanted to find out if there were any differences between the two groups in terms of deaths from any cause and rates of further heart attacks. Revascularization, a procedure to restore blood flow to parts of heart, or hospital admission for heart failure. Low-fat diets prolong life in middle-aged and older adults, shows study. Short-term clinical trials have demonstrated the health benefits of low-carb diets or LCDs and low-fat diets or LFDs for weight loss and heart protection. Now, a study published in the Journal of Internal Medicine looks at the effects of these diets on mortality in middle-aged and older adults. In a study of 3,71,159 individuals aged 50 to 71 years, 1,65,698 deaths occurred over a median follow-up of 23.5 years. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.